Namaskar, I'm Manoj Kumar. Welcome to the program Meet Doctors. Today you'll meet
I am Dr. Parul Chawla Gupta, Associate Professor, Department of Ophthalmology, PGI. I am a cataract, cornea and refractive surgery surgeon at PGI.
She talks about eye donation campaign at PGI Chandigarh. She says make eye donation a family tradition. So without spending so much time, let's meet Dr. Parul Chawla.
So we are celebrating the 38th National Eye Donation Fortnight from 25th August to 8th September this year. And this has been being celebrated every year. And in this fortnight, we create awareness for the masses for eye donation awareness, especially among the youth who are the messengers of the society. And we also tell them that don't bury or burn your eyes, just make them utilizable for other people who don't have eyes. So this is corneal transplantation can take place for cornea blind people. So as we know, there are around 1.2 million corneal blind people in India, and only 25 to 30,000 eyes are collected per year. So there is always a gap between the demand and the supply. So we always need more and more eyes to be donated so that they can cover the backlog. So there is always this demand and supply problem. And every year 25 to 30,000 more cornea blind people are added. So it increases the backlog of the corneal blind people. And so in this fortnight we are having many lectures in various schools and colleges, as well as we had poster making competition amongst school children from class 7 to 10, and these were the beautiful posters that the children made. And this is just to sensitize the young children for eye donation. And we are also organizing article writing competitions on eye donation. Then we are even educating the nurses who are going to be there with the patients at their end stages of their lives. So we are organizing Rangoli competition and poster making competition for the nursing students as well, to increase eye donation awareness amongst them. And eye donation can be done easily. You just have to fill a pledge form, and that pledge form is available at all government hospitals like PGI and GMCH 32. And after you fill the form, you have to submit it. It is even available online now, and once you submit it, you will get a card, and you have to keep that card in your purse. And in case of any unfortunate event of a death of your family member, at least the relatives know that this person wanted eye donation and their eyes can be donated. And there is another misconception about eye donation, that eyes are taken right after you pledge your eyes. But it is not like that. Eyes are only taken by the doctors after you die. So during your lifetime, nobody will come and take your eyes. You just have to fill a form for that, and after your death, the eyes will be taken. And after your eyes are taken, artificial eye will be put inside your eye, which will look exactly like your own eye. So there will be no disfigurement, no problem in the way a person looks. And also the procedure is very quick. In 10 to 15 minutes the eyes can be taken, so there is no delay in the funeral also. So if your relative there's a death in your family, you must contact your nearest eye bank. 1919 is a toll-free number, and there are special numbers for PGI as well as for GMCH. And our eye bank team is available 24/7, and they'll come and just take the eyes and put the artificial shell, and you won't get to know that the person has donated. And we also provide a certificate honoring the person who has died and who has given the eyes for somebody else's surgery. So it is a very noble cause, and I think all religious people also, and priests, and everybody should dispense this information in the society, that this is a very noble cause of eye donation. And there is another myth for eye donation, that you won't get your eyes in the next life if you donate your eyes in this life. But this myth is absolutely wrong. It is a misconception, and eyes, it is nothing of this happens. In fact, it is a blessing to donate the eyes so that they can be utilized by somebody else, and somebody else can see this world when you are not there. So eyes can be taken from young people as well as from old people, and everybody can donate eyes. Any person who has diabetes, any person who has hypertension or has undergone any eye surgery or any other problem, they can also donate eyes. Only we don't take eyes in those cases when they have infections like HIV or hepatitis or syphilis or some brain fevers like meningitis and encephalitis. We don't take eyes in those cases, and we test all the eyes when we take them, and after complete testing only we transplant the eyes in the patient. So corneal blindness can be due to various reasons. It can be due to infections, it can be due to trauma or injuries, or it can be due to some vitamin deficiency like vitamin A deficiency. So the front portion of the eye, that is the cornea, that this glass like portion, this gets white opacity on it due to all these conditions, and we can transplant cornea only in the corneal blind people. If any person has glaucoma or any person has retinal detachment or any other issue, we cannot do corneal transplant. We can only replace the front portion of the eye, that is the cornea.